people who have knowledge about medical to improve your health style. And here today is an opportunity. We have another expert from somewhere and he will be able to tell you. We are going to discuss about quite a matter of things and about infertility. More especially women, they all know about the pain of living in life without a child. It's really a paining experience, and you can tell. We have been told that we have an expert, a doctor, and he will tell you all his titles in respect of medical language. We have got a complaint from our viewers. You bring a host, your hosts are various people and they are talking about medical language. Today we are going to ensure that at least doctors simplify by speaking to us English, but a little bit of medical, because that is mandatory and he will be there. But we are going to ensure that he speaks some English part of it. Doctor, you are welcome on Youths Media.
Thank you, sir. I'm so grateful for this opportunity to be with you here on Youths Media. I'm Dr. Piriton, that is the known name on most of my social media handles, but my actual name, I'm Dr. James. I'm a medical doctor, a general doctor from head to toe. So I'm hosted here on Youths Media by Mr. Sel.
Thanks a lot, Doctor.
You're welcome.
Today we have a topic and we have a general problem. Our viewers, they are aware that we always bring experts in respect of their request. There have been a number of questions within the population and within the viewers. There is a slogan which said that it's in Luganda that emiti emito gye gigumiza ekibira. But some people, they have looked for those young trees and are nowhere to be seen.
I see.
And we are wondering, what are the causes of the infertility? It's our topic of today. And we have the experts going to respond. Doctor, how can a layman like me and my brothers and sisters who are watching us on Youths Media right now, if somebody tells me, define the term infertility, or how do you define, if somebody talks about infertility, what is infertility?
Okay, basically, let me thank the viewers for this specific channel. Infertility as a topic is a broad topic. Many of you are saying you have infertility, you are infertile, but the fact is you're not. To define infertility, to say a doctor to say that you have infertility or you infertile, what it means? It means you must have practiced sexual activities for 1 year, and that 1 year unprotected for 1 year, those are 12 months. That's when we say you infertility. You have infertility. Otherwise, until you do sexual activities for 12 months continuously unprotected, then we can say you have infertility. That's how we can define it in simple words. 12 months sexual activities unprotected without conceiving, then we say you have infertility.
Doctor,
yes,
12 months,
yes,
continuous sex, viewers, 12 months continuous sex, no pregnancy, you are infertile.
And it must be, you should include it, unprotected sex.
Not my words.
It must be unprotected.
Unprotected sex.
For 12 months, and you are not conceiving, then we say you have infertility.
My sister, how long have you been having sex? How long have you been having sex? Doctor is 12 months, constant, unprotected sex. If you have just only 6 months, 2 months, 8 months, you are not infertile. So, for you to have had 12 months of unprotected continuous sex. Here is the medicine. Doctor,
Yes, please.
if 12 months of unprotected continuous sex
Yes, please.
is the proof of infertility,
Yes, please.
then what are the causes? What
Okay.
are the causes of that infertility? Because 12 month continuous sex, I don't know. Our viewers will kill us, but what are the causes?
That's the fact, actually.
In our mothers,
Many
with women.
people misdiagnose. They just go to clinics and tell them, you have infertility, you have infertility. But they have just had a couple for 3 months. They have waited the 4 months and they're like, you're infertile, you're what? It's not true. They must understand and differentiate between this. So you asked about causes. Basically, we shall categorize causes because it's not a specific cause that it is one. Let me say, it's not malaria that it is caused by mosquitoes, parasites. No, it's a broad thing. It's not a specific thing. So we are going to discuss about what causes infertility. Because there is infertility in men, there is infertility in ladies. So we can't broadly, we have to broadly categorize each one. So if we are to start with men, or where should we begin from? Because both sides are affected. Never say it's only women. You must understand that.
Doctor,
Yes, please.
the request from the viewers
Yes.
is more especially with mothers, based on our cultural instincts
Oh.
and where we are coming from. When you talk about infertility,
Yeah.
most people, the mindset goes straight to the woman. It's rare to find, even in family conflicts, whereby we say, you man, you doesn't produce. Like, from my childhood to that, I have never had such. And it's rare to hear it. But only that we hear. Mukazi goli mugumba, and even some women, number of women have failed at their marriage cause and on basis of infertility. So I think ladies first always.
Okay. Even in health, to be ladies first.
No,
I didn't
no.
say that. Please, I didn't say that.
Yes.
So
okay.
the fact is, that's what you've been hearing, and it is really a myth in the community that it's only ladies who have infertility. We shall see. You will see how men have infertility, and it is really carrying almost 40% causative. Women carries around 40, men carries around 40. You see, it's equal side. Okay, let's start with the ladies first as the slogan or the rule of the earth. Ladies first. What causes infertility?
We are asking.
Basically, there are many causes of infertility. I'm going to broadly explain you one by one. So as a matter of fact, let's start with a simple one. How do ladies practice their perineal hygiene? How do ladies practice their perineal hygiene? What do I mean? Perineal hygiene, how do ladies wash their private parts? Let's start from there. Infertility can start from there. Do you know what happens? Most ladies do what we call V-douching. I don't want to use that word, vagina, but I don't know. V-douching. You understand? When I say V-douching, it means you are washing your private parts and you're inserting their fingers to clean it, which is a bad practice. Why? When you do V-douching, when I say V, you know what I'm meaning, douching. V-douching or V-cleaning. When you use those fingers to clean inside that side, you are washing away the normal flora, you are altering the environment of that side. As you are altering the environment, it means you are leaving this site hostile. Hostile means it is harsh or very stubborn. The environment will become harsh to the rest of the conditions. Let me say,
Doctor?
Yes, please.
Sorry for interruption.
Yes, please.
But I think, and I have a strong feeling to say that, you can comfortably tell them the right word, because we are in medical and it is to save their own life.
Thank you so much.
Yes, so you can go ahead.
Thank you so much. So, ladies who do, in medical we say vagina douching. Vagina douching is a procedure whereby you wash your vagina and insert fingers inside. It's a common practice in most ladies outside there, because they have a feeling that this side is dirty. No, we don't do that. Don't do vagina douching. How we practice, how do we wash that part? We just wash on top, the labia majora and minora, and that's all. Why don't we practice vagina douching? Because remember, this site or your private part has a normal pH. Normal pH, it means acidic, alkalinity, or it is okay. You remember the science of P around senior 4. Acid is, it means it is harsh. Then alkalinity, it means it is somehow normal. So, your environment there, it has a pH of 6.5. A pH, it means it is an alkaline environment. When you pour there water while doing this cleaning, you are changing its environment. So why do I bring this into infertility? When a man pours those semens into you, the environment you changed here is going to burn all these semen. Okay, semen is semen, but this semen contains sperms. So that hostile environment is going to burn these sperms which the man has poured, because you altered its environment. Let's start from there.
Doctor.
Yes, please.
Altering the environment of our private parts by the virtue of science you call the vagina, the women private parts.
Yes.
By altering it using fingers to clean it.
Pouring water
there always.
Pouring there
leads to burn the sperm of the man.
Yes. Because it is a hostile now, it has a pH of 6.5. Water has a pH of about 7. Other solutions have different pH. Some people pour there Coca-Cola. Others use their Savlon.
Coca-Cola?
Doctor,
wait a minute. Coca-Cola, the one we drink.
They had a myth that it brings a secondary virginity. You didn't know?
Viewers, tell us. Anyone who I am waiting someone in our comment section to see whether someone has gained the virginity back due to the use of Coca-Cola.
They used to pour, though it narrows, but it doesn't bring the secondary virginity. Coca-Cola has a pH of about 3. That means it is acidic. When you pour it there, yes, it will narrow your parts as you want, and it becomes smaller and you get virginity as you think, but no, it is altering the environment there. When this man pours those sperms there, it will just burn them because it is hostile. And that is the infertility part view of it. But health-wise, it is also not ethical and it is not really good. Why? When you wash away and clean, scoop off all the normal flora, this part, the private part, has normal flora. Normal flora, those are normal bacteria that side. They help us to compete with the pathogens. When I say pathogens, those are bacteria which causes infections like UTI. So when you scoop off all these bacteria which are normal there, they are normal, we call them normal flora. The lactobacillus, they are normal flora of that part. So when you put the fingers and remove them like this, you are leaving that site without a normal flora. So when these bacteria come outside this site to enter your vagina, they will just cause the infection. But if you did scoop the normal flora and another bacteria comes, they will fight for food there. As a result, the normal flora will kick them away. Because for them, they are used to the environment. They will clear them and kill those organs which would affect and cause UTI. So you see how normal flora help you to keep that site without infections. Today we didn't come for infections, it was about infertility. But you have known the essence of not doing vagina douching. That's one cause, by the way.
Before we leave that section, doctor,
Yes, please.
our viewer is now, there are now questions
Yes.
in men and women who are watching now.
No problem.
They are kind of like, now doctor is kind of to tell us that should we stop washing our private parts? Men are like, hey, doctor, to now these people are going to come when they smell, because in case a male and a female, they meet in that during 6 hours or sex part of it.
Yes, please.
In case of any bad smell,
yes,
the first accusation women have, this girl is dirty.
Okay.
This woman is dirty. Here our doctor specialized comes and tell us we are fighting infertility and we should stop douching, washing, using our hands and so on.
That's a good word, douching.
How are we, when do we separate? Because now it's a tug of war into relationship now. You have raised a tug of war. When I and my wife and my girlfriend and my fiance do separate, that smell, the one which is so, let me name it, natural, and the one of known of being dirty,
an
abnormal one.
Okay.
Because now they are going to stop the what you call douching, vagina douching, whereas for them they call it cleaning, washing, abbreviation, sanitation.
Okay.
Now you are obstructing our mentality, sanitation.
Okay. To answer your question, you know that organ is a gland. That part is a gland.
What is a gland?
A gland is like something secretory, something which secretes. It secretes fluids.
Yes.
That's what I can somehow define as a gland.
Yeah.
It means it cleans itself. How many times have you washed your stomach? But what do you eat there? You eat everything. Food, cassava, what? You throw everything. Did you think of washing that stomach? It is a gland. It cleans itself. That's why it has that environment of the pH. It has all the capability to clean itself. Okay, you talked about the smell. Let me tell you. A smell, I think I will come back here and explain about even discharges and smell and infections. That site, if you feel that there is an odor which is not good, or there is a bad smell at that site or in that site, just know there is a problem.
Say it again.
If you find there is a smell in your private parts, you ladies, trust me, there is a problem. Unless you've just completed your periods. When these ladies have just completed their periods, there is that some discharge which sometimes is smelling. It is okay. It is smelling because it contains leukocytes. Those are white blood cells which are dead. They are, we call them pus cells.
Yes.
Yeah. Due to the fact that she was bleeding, in the bleeding, it is fresh blood. There are a lot of plasma cells. There's a lot of red blood cells and white blood cells. So during her last day of menstruation, there will be that first some discharge.
Yes.
Sometimes it is brownish, reddish to some color. It can have that scent of smell. It is okay. It is normal. It is understandable. That's why I advise men not to touch their ladies when they have just menstruated. Otherwise, you will not feel a good scent.
Yes.
And it is normal. Other periods or other days, you have a bad smell and you've not completed your periods. Trust me, there is a problem. There could be either a urinary tract infection or a pelvic inflammatory disease. So you need to go and see a doctor who will screen you for those infections. Don't say, doctor has refused us to clean up there, down there. It is going to cause infection, we shall smell. No, please. That part cleans itself unless you have an infection. So I hope I'm clear. that the smell will be there if she has just completed her menses. We agreed. And it is normal. But other days, it must be a very clean part without any scent. If you feel a bad scent, please go see a doctor who will pick off some urine sample to do urinalysis or urine tests on you. So for the scent, I think I have explained you that they won't smell.
Yeah.
Unless there is a problem. We are talking about infertility. Let's not leave the topic.
Yes.
For the issue of infection, I'll come and guide you and teach you. I'll be available for that.
Our viewers, we are still on causes, and that was one cause. One cause. Youth Media is always there to bring experts. Dr. Piriton is here with us and is going to continue our come. Just mention your questions in your comment section. Ask anything, answers available. Doctor, you have talked about that one cause.
I have several.
Let's continue another one.
What causes infertility in ladies?
Yes.
Not talked about men. We shall talk. You men, don't say for yourself. We shall mention about you. Please, just keep watching.
Yes.
So that was one cause. We have another cause which is very serious. PID. Pelvic inflammatory diseases. Pelvic inflammatory diseases. PID. Many of you have been diagnosed with that disease. But good enough, it is treated. Just antibiotics and you'll be fine. So how does a pelvic inflammatory disease occur? Who gets it? How does it occur? Doctor, how should we know that we have that? So with the PID, first of all, it will come as a result of poorly treated sexually transmitted diseases. The most poorly
transmitted
diseases, poorly treated.
Poorly treated.
If you get what we call sexually transmitted diseases,
yes,
and you don't get definitive treatment, or you don't really treat it to the maximum, then the infection will ascend from your vagina through the cervix. The cervix is the mouth, the opening of the uterus. When the infection comes from here, it will enter into your uterus, and when it reaches the uterus, then it becomes a PID. PID infections, it's a broad term. Those infections affect your reproductive organs. Which organs? We have the uterus, that is called the nirvana. We have the fallopian tubes, what you call the tubes. We have the ovaries. Those are the three major organs these PID infections really affect. But these infections, in most cases, they ascend from the downer parts to the upper, ascending from the UTI to PID. So, a PID causes infertility. How? When you have inflammation in the uterus, an inflammation is an injury or any damage to that part. Remember, where the damage occurring is where the sperm will pass. Now assume the PID has already caused their scars. It has left wounds, their scars. This sperm will not swing properly to the site to find the egg. So it will be inflamed. And as a result, it may also inflame other reproductive parts like the ovary, which produces the hormones for menstruation, which produces the hormones for your pregnancy.
Doctor.
Yes, please.
Viewers, we are coming back. This program proudly brought to you by Fundamental Human Rights and Protection. Your liberty matters. Let's go for commercial break and let's come back. Welcome back from our commercial break. Youth Media, the new era. The world has changed and Youth Media is near you than your friends. It's there on your phone, it's there on your tab, it's there on your computer, and even there on your smart TV. Just go to our website, just go to all our media platforms. Everywhere we are there to serve you with a useful information. We are back to our program, the health clinic. We are there to change your life. Doctor.
Yes, please, Mr.
You were still telling us about the causes of the infertility.
In females.
In female.
Or women.
In women.
Yes, please. So, we stopped on something like PID.
Yes.
So, PID, I explained about it, how it causes. And the PID can affect, as those parts I mentioned, the uterus. It can cause inflammation of the uterus, what we call endometritis. It can affect your fallopian tubes, the fallopian tubes where the sperm will pass like this. To reach, remember fertilization, you must understand, whoever got fertilization, a normal fertilization occurs in the tube at a space called ampulla. So if that tube has a problem, trust me, you will not conceive. So a PID can affect the uterus by causing inflammation there. A PID infection can also affect the fallopian tube. The fallopian tube, if it is inflamed, we call that one salpingitis. In the medical term, it is salpingitis. When your tube is inflamed, it means it can't propel the egg or the sperm for fertilization. So, you're seeing how PID affects your infertility. So, also a PID or pelvic inflammatory disease can as well affect your ovaries. Remember, the ovaries are the one which produce your egg. Where will you get the egg, you woman, if you have no ovary? There are those who are born without an ovary, but we shall see those cases. So if your ovary also is affected, we call that one ophlitis. Ophlitis is inflammation or injury to the ovary. So there are also those one who have blocked tubes. Your tubes are blocked, or the fallopian tubes are blocked with water. We call that one hydrosalpinx, when your tube is occupied with water. So all those one occur after PID. Remember, PID is an inflammation, an injury. An injury, it is a battle whereby a lot of things happen. There's a lot of water produced, a lot of cells there, everything blood. So as a result, it will block your tubes. It was still a PID infection causing all this. So when the tubes, when the ovaries, the uterus are all inflamed by your own PID, it simply means you will have difficulty in conceiving. Remember, this egg from the downer part, from the vagina, let's assume your vagina is not hostile, it is okay, it is kept in a good place, it has received the sperms and they swing through the cervix to the uterus. When they reach there and the uterus is inflamed, you are dead. If they won't swing to the fallopian tubes, they will stop there. When they stop there, then it means they will not reach your egg. Or they may reach through the fallopian tube to the egg. Reaching there, the ovary is also inflamed. So where will really fertilization occur? It won't take place. That was one cause, PID, pelvic inflammatory diseases.
A second one, that one.
So, the second one is hormonal imbalance. A lot of people there are saying, I have hormonal imbalance, I have hormonal imbalance. Yeah, me, I have hormonal imbalance. It's the song of the day.
Doctor.
Yes, please.
All those are still causes of infertility
In
women.
females. Yes.
And our viewers, I think this is more than serious. It's more than a problem. Families tears apart because of infertility. I think this is not just about enjoying and laughing and all that. This is another kind of education. We thank Dr. Piriton to accept to come here to give you and me advice which shall help our family, our relationships to live in harmony. Everybody decide to have a child. I thought that there are one or two, but now we are on number 3. Get a pen and a book. Write somewhere. Share this information. You sit on it, you are sitting on someone's happiness. Save a certain family by sharing this information. And save someone from infertility. This is Operation Save Women from Infertility. Doctor, let's continue with the course.
So, we're on a third one.
A third one, hormone.
Though we always explain such that we don't leave gaps.
Yes.
I mentioned about PID. I didn't hear what is it. They reach a moment and get even half-baked information. So I'm here to explain you the cause, how it occurs, and what happens. And I tell you the possible options. For PID, you have antibiotics and cover you up. We shall know how we treat infertility later in the coming segments. So, the third one, we said it is hormonal imbalance. A lot of people are saying hormonal imbalance, what is it? Some of you even don't know what is hormonal imbalance. When you have a hormonal imbalance, it means, okay, they are what we call reproductive hormones. Females have reproductive hormones. Always monthly you menstruate. It means there are some hormonal changes which occur and you menstruate. You don't just menstruate from heaven. There are some changes, what we call physiological changes, which occurs in your reproductive system and you menstruate. So, amongst the hormones we have which are responsible for your cycle, or for your menstrual cycle, or for ovulation, or for your fertility rates, we have estrogen, we have progesterone, we have FSH, that is called FSH, follicle stimulating hormone, and luteinizing hormone. Those are the major hormones we consider for infertility or for fertility. So, why do we have hormone imbalance? There's a condition we call polycystic ovarian syndrome. It means you have, in Uganda they say obuzimba ku majigo. That's the term I can say. You have polycystic ovarian syndrome. I can't say it is an abscess. Those abscesses, okay, let me use the word abscess, but they are not really abscess. They are just cysts. A cyst is something which contains water. So every month when you bleed, you develop a cyst. But those cysts, they go away after your menses. Sometimes you develop those cysts in abnormal numbers and they become many. And they resist, they fail to go. That's why if we diagnose with the polycystic ovarian syndrome, we rarely prescribe treatment because we know they are always there, they come and go. These are the most common things which causes hormonal imbalance. Remember, those cysts sit direct to your ovaries. Your ovaries, remember, this is a factory for eggs. It's an ovary. So when they sit there, it means they are suppressing your reproductive hormones or your reproductive system. So those hormones, they work hand in hand for you to conceive. Let me tell you, did you hear about what they call safe days? Yes, please.
You have mentioned those hormones.
Yes, please. 5
of them.
Yes.
And guess what? The viewer is like, Doctor, I'm lost. The medical language is too much. Even pronunciation of it, yeah? Kindly just let's give us a little bit of it one by one and let's try to understand what it means so that we understand.
When I say a hormone, hormones, a lady has hormones.
Yes, the other 5 parts, they have been so medical.
They are, okay, their names can't change to English.
Okay.
We shall take them. There are many, but I'm giving you the major ones.
The major 5.
Yes, at least those ones which we really see. And when we test them, you can even see the results yourself. You say, hey, progesterone, I have 100. Yet the normal range is 50. It means it is high. You just know I have hormonal imbalance. and it can lead to infertility. The basic 5 hormones I was mentioning is progesterone, estrogen. These 2, they are always in your ovaries. They are produced during your menstruation. Then there are other 2, the luteinizing hormone and the FSH, follicle stimulating hormone. Those 2 are produced by a gland in your brain here. It is called the pituitary gland. When they are produced, they enter your bloodstream. After entering your blood like this, they travel to the other side, to the ovary. Remember the ovary, I said it is the factory for your eggs.
Doctor, I've just previously talked about hormone imbalance, and it's one of the causes of the infertility. There are more and more and more, and doctor is there to elaborate all the causes, all the possible causes of the infertility. Reason being, you have been there and you underestimate, this is minor, yet, my dear friend, you are losing your marriage, you are losing your happiness. We all believe that having a child is another peace of mind in home and in family. Doctor,
Please.
you have talked about hormone imbalance.
Yes.
What are other causes of infertility in women? Particularly, we are still on women.
Okay, basically, let's continue from there. Apart from hormone imbalance, we have what we call fibroids.
Fibroids.
Have you heard about that term or such statement?
Me, I heard about fibroids,
Yes.
but it sounds too scientific.
Okay.
Yes.
Fibroids in science, those are kind of tumors, but they are not cancerous. When I say it's not cancerous, it means it doesn't contain cancer cells.
Okay.
It is there, swollen. Tumor is something which is swollen, but not cancerous. Yeah. So fibroids, they are non-cancerous tumors. They always are present, or they affect those women especially. But basically they are also due to hormonal. You see the issue of hormonal. We shall talk about it. So those fibroids are due to hormones. That's what the theory talks about. They don't have a clear pathophysiology, but they are related to hormones, especially estrogen. So those tumors, in most cases, they affect women who have not had a child. Like those mothers who delay to have children, like at 40, 30, 35, you are at risk of a fibroid. Let's not discuss that. We shall discuss fibroids as a topic later in the future. So fibroids, those are tumors which are always there in your uterus. Uterus is the womb which keeps a baby. They are always also classified. They are what we call intramural fibroids, whereby they enter into the tissues of the uterus. But there are those which are just pending in the cavity like this. They are there inside like this. So when those fibroids are there in your uterus, uterus is a womb, a sac where the baby sits, or where implantation takes place, not fertilization. Implantation is when fertilization has occurred from the fallopian tubes, we agreed. Then implantation occurs in the endometrium. Endometrium is the last layer of the uterus. So it's where your baby is going to implant like this. So where the baby implants, there is already a fibroid. Where is baby going to be implanted? That's when you get ectopic pregnant. Baby will go into the nseke or the tubes. Baby will be in the tubes and grow from the tubes. At 3 weeks, 4 weeks, 5 weeks, the tube bursts. So fibroids is another cause of infertility. The egg of a man or a sperm may fail to peruse through these fibroids. If it peruses through, fertilization still will be difficult. Remember, this egg is fighting hard to reach the egg of a woman. The sperm is fighting hard, or it really goes through obstacles to reach the woman's egg. That's why you have fibroids and they are causing infertility. Really, there are those fibroids which occupy the whole cavity. It's like a balloon. Let's consider a balloon as a uterus. Put water in a balloon. That is now, those are fibroids. Water are fibroids, we are assuming. So it means they have occupied the whole uterus. There is no way a sperm can penetrate or swing through that gross tumor to reach an egg. So that's how fibroids affect and cause infertility. So they can also be removed surgically. We do endometriosis, we can just scoop them off in surgery. So that is the fourth cause of infertility in females. So another cause,
Doctor.
yes,
Before we move to what you have called, you have talked about fibroids.
yes,
And these fibroids, you have talked about women, my sisters, who are a little bit aged,
who delay to have children.
who delay to have children.
Yes, it is a risky factor.
You are kind of like informing my sisters that do delay to have a children might be another cause of infertility?
Yes. In actual sense, because now you may develop fibroids, and the fibroids occupy the uterus. As a result, you can't have a baby. It is all occupied.
Doctor,
Yes, please.
my sister, how old are you? Because we are asking how old are you, because it's also another challenge. Delay to have children means you are a candidate,
You are risking her.
you are a candidate
Yes.
of fibroids. And you are a big candidate of infertility.
Good. You have studied it well.
Not my words, from Dr. Piriton.
It is true.
You are talking about another cause.
So another cause, basically those are the major causes I cited, which are really the worrying problems. There are also other congenital anomalies. The words are big or what? Okay. When I say
That's it. So scientific, huh?
when I say congenital, it means someone was born with that thing. The congenital is from childhood. That's the congenital thing I mean. There are some people who are born with congenital anomalies. Anomaly means something not in a normal range.
Yes.
You can be born without a uterus.
Say it again.
You can be born without a uterus or a sac which keeps a baby.
Naturally born without a uterus.
Good.
A woman
Yes,
to be born when
without a uterus. You can be born without a fallopian tube. You have a uterus, but it doesn't have fallopian tubes. Those are congenital anomalies, which I wanted to speak last because everybody would worry. Congenital anomalies, they are conditions which occur from when you are still in the mother's womb.
Doctor,
Yes, please.
apart from my viewers, I think they are also shocked, as I might be shocked. You talk about someone to be born without uterus,
Yes,
someone to have uterus without fallopian tube.
yes.
Do they, more especially to women, because I know you receive number of patients
Yeah.
at your working place, do really the patients realize that, for me, I don't have, when do they realize, are the parents who keep silent about such a matter? Because at the end of the day, we are talking with mature people. And these mature people, they have been there, knowing and hoping, because we know that whenever somebody goes into menstruation, is a candidate of pregnancy.
Yes.
And he believes or she believes that she has all the material and equipment to obtain, to conceive, and to give birth. Here a scenario comes and you talk it as a natural cause. You call it, let me name it natural disaster.
You are pregnant at 3 months. We are expecting your baby. There's a process we call organogenesis at 3 months. It means the baby's organs are forming, the head is forming, the liver is forming, the heart is forming, the legs are forming, the eyes are forming, organogenesis. At that period, if you just swallow anyhow drugs anyhow, you have flu, you go at the clinic, buy drugs. You have headache, go and buy drugs. When you are pregnant, at that period, it's really a fragile period. When you swallow those drugs, those are the drugs which affect the baby inside. Remember, the organs have started forming and drugs affect the baby. You'll get congenital anomalies or teratogenic effects of those drugs. That's why we need to health educate these people. During pregnant, it is a special time whereby you must be under professional doctors or professional advisors. People take drugs anyhow. So, congenital anomalies, they don't occur anyhow. They occur due to some reasons. Either you are highly exposed to radiations, either you are highly exposed to chemicals like drugs, alcohol. It is when you are pregnant or when your mom was pregnant. That's when you have those congenital anomalies. There are mothers who have received a lot of ladies. They have never seen periods and they are adults.
Since childhood?
Yeah.
To date? How old are they?
I received several, of course I can't say.
As they know the age, in terms of age?
20 plus. Some are not worried. They're like, I waited until I would get married, then I need to see a doctor and sort it out. So, some are reluctant. They don't know whether they have a uterus or not, or they don't have fallopian tubes or ovary. Some have the uterus, have ovaries, but maybe they are atrophied, they are small, they have shrinked. Due to other factors, those are hormonal etc.
We are on the causes of the infertility. Those are still causes of the infertility. The professional is telling us, opening
women.
Our eyes. Women, this is your session. This is your time to share the information. You sit on it, you will be blamed for yourself. Save a life by sharing. Gita says, on continuation of this program, Health Clinic, proudly sponsored by Fundamental Human Rights and Protection. Your liberty and freedom matters a lot. Let's go for the commercial break. And we come back. Welcome back from our commercial break. Gita says so we are Uganda Health Show, and it's a health clinic. It helps you to save life just by sharing information. That share button is much more essential, but to follow is much more valuable. Then you click on the notification, then that's marvelous and wonderful. You will be always reminded. Go to our website and everywhere. Youth Media, we are the new era. Everywhere, on your phone, on your tablet, on your laptop, on your computer, on your smart TV, everywhere you are with us. We went into a commercial break when doctors elaborated about the causes. They have mentioned more than, and I know you have got a lot. But there is a lot of questions about infertility. I wish we could spend the all night, but I think we are time limited. Doctor.
Yes, please.
What are the category, because we are still talking about infertility in women.
Yes, please.
And men, we are coming.
Yes.
But in women, what are the categories of people who are highly on a risk of becoming infertile, or else in one or the other? A viewer is like, when do I detect, when do I realize that For me, it seems I'm in the trend of infertility. When do a woman, when do a girl, when do a lady realize or wake up or detect that I'm infertile?
Okay. To answer straight your question, he's saying who is at high risk of getting infertility.
Yes.
And how do you know that maybe I'm infertile, maybe I'm at a big risk of getting infertility? Okay. We began with a definition. First of all, you must understand the definition of infertility. Is when you have unprotected sex continuously for 1 year. Those are 12 months. If you do that and you are really not achieving the results, then you are already infertile. Leave alone that. There are some factors you may see in your life and say, really, I'm likely to have infertility. Even though the 12 months are not yet over, but you can have a sense and know the problem. How? If you have a heavy menstruation periods. What do I mean? Heavy, it means a lady must bleed about 2 to 5 mils of blood. That is 1 teaspoon table. Approximately, you shouldn't bleed more than a spoon table. This sugar table, it's a teaspoon table. It's what I mean. That's 5 mil approximately. You shouldn't bleed more than that. So if you have heavy bleeding more than a 5 mil, trust me, you are a candidate. Not confirmed, but you are at a high risk. It simply means you have hormonal imbalance. That is heavy bleeding. If you have heavy bleeding, trust me, you already, I can put a question mark. What else? If you have prolonged periods, a normal periods has to go for 3 to 5 days strictly. Even 2, you can reach 2 days, 3 days. You can't bleed for a week. You can't bleed for 2 weeks. There are people who bleed for more than that.
You are saying that it's abnormal for a woman to bleed for more than 5 days?
It's really called metrorrhagia. It's an abnormal bleeding. It's really more than the normal range. A normal range should be from 2 or 3 days to 5 days. Even 5 is the maximum. Really, if you exceed 6, 5, 7, 8, that is much. It's metrorrhagia. It's prolonged. It can't be normal. So you also put a question mark there. There could be a hormone which is missing. So you are a candidate for hormonal imbalance. Not yet confirmed, but already periods are already showing it. Prolonged periods, heavy menstruation, those are 2 factors you must consider. What else? If you have an irregular cycle, a normal cycle, it must be, I think we shall have to discuss about this because it is a big topic. When I mention about a cycle, many people don't know cycle. So a cycle is a time. Is how do we count a cycle? The first day you bleed is the first day of your cycle. And the next day you bleed is the last day of your cycle. So how do we calculate a cycle? The day, let me say today is first, and you start bleeding. Your cycle has started on first. You count those days until the next day you bleed. So those days, they must be regular. If you count 28 days, they must be 28 days. 28 days, after 28 days, you must bleed. That is a normal cycle. In a hospital, you will come and find Dr. Piriton. He will ask you, is your cycle regular or irregular? You will ask me how. I will ask you, is it consistent that the days don't change? If you tell me it is irregular, I just also suspect there could be a hormonal imbalance. Remember?
Doctor?
Yes, please.
I'm listening attentively.
Yes, please.
And I gain various questions.
Mm.
Our viewer who is out there, we have various viewers all over the world.
Yeah.
And some of our viewers, they are like, you would have used Luganda or any other language. But these are general problems and challenges, whereby those challenges are within to each and everyone, despite the tribe and everything.
Mm.
You talked about menstrual cycle.
Yes, please.
This menstrual cycle, is it a kind of a cycle that somebody should not miss at all? And if you miss that cycle, there must be abnormality in the body.
So the fact is, a cycle is a type. Those are the days.
Yes.
Okay. Menstruation, as the word menstruation, it is divided into several parts. There is menstruation, that is the time you are actively bleeding. That is a period.
Yes.
After menstruation, there is another period. It doesn't stop there. After that, there is another period which is called the ovulation. Ovulation, it is the time when the mother or the woman is really liable to get pregnant. And we shall discuss about it. It's a really good timing. If you have there your husband and you want to get a baby, you must first learn your cycle. I'll teach you how to calculate and know the actual good days to conceive. That is ovulation. And it is still in the cycle. So when I say cycle, it means the first day you bleed, you count 1, 2, 3. You start counting your cycle. Until the next day you bleed. Bleeding stops, I said, after 3 days.
Yes, yes.
When bleeding stops, you still count those days until you bleed again. You put down those days. You start counting again. Those days must be
consistent.
A normal cycle always has 24 days to 30 days. If you have a cycle of 28 days, it's okay. 26 days, it's okay. 29 days, it is still okay. So if you want to know your ovulation period, the actual time to conceive or to get a baby, it's the ovulation time. You just get your cycle days and divide by 2.
Oh.
That period is sensitive there. It's really a good target if you are looking for a child from some man.
Ovulation period.
Ovulation. It's really so sensitive.
For someone who's looking for a baby.
In infertility, we first tell you to count your cycle if you say you have infertility. Sometimes, anyway, we shall discuss it in management.
Yes.
We shall know how do we target. Sometimes you are not sick, only that you don't target ovulation days and you say you have infertility. You have sex in other days which are not necessary. There are some days. It's not that every time you have sex you will conceive. Never, even though you have a normal fertility rate. But there are days specific for conceiving. That is ovulation. We shall discuss it in the other coming sessions. Yeah, we shall discuss that in the coming sessions. So, those are the people. If you have those irregularities in menses, you may really somehow be a candidate for infertility. Also, you must not forget, the more you grow older, a woman, you are increasing your chances of becoming infertile. Infertility rate, the chances are increasing with age. So the more you delay to have a child, the more chances you are increasing to have no baby. That's the fact. Your ovaries are shrinking. They are not active. Your hormones are useless. So you are developing fibroids. So the more age, the higher rates, the more you increase your ages, the more you add on aging, aging chances are increasing with aging. So you must take that note. 35 years, you're at high risk. Then there are these overweight, heavy. If you see you have heavy weight, you do your body mass index, BMI, and you find that it's really higher or high. It's an abnormal weight. You have heavy weight or obese, or then you just know you are at a high risk. Such heavy weight people, they always have abnormal hormones. Their hormones are imbalancing. All those are factors really which can predispose you, or which can make a doctor think of infertility.
Doctor.
Yes, please.
You talked about the size of women.
Yeah.
And you know, some women out there, they are like, doctor, please, we are naturally in our size.
Yes.
We never choose what we are now. We never went to FACO or anywhere.
Some go there.
But those who have never went there.
Okay.
And you're like, should we consider this as a punishment from God? And some men who are watching now, who have had a doctor talking about that, those fat women, they are at high risk of infertility.
Good. You've said it rightly.
Yes. Now, they are like, doctor said, doctor said, a fat one is
but
at high
weight
risk.
can be controlled. Weight can be controlled. So the issue of obese or overweight, it must be not a problem too. Yes, there are ladies there who are overweight. Don't start blaming and say God gave me this weight. You can change your weight by diet, by exercise. We shall still discuss that. And that weight, it's not only for infertility. It has other medical conditions. It is pressure, kidney diseases, metabolic disorders. If you have overweight, underweight, it is a problem. It is a risk factor. You must have a normal BMI. It's not a test you are going to do in a laboratory. Just do your weight and the height. Call any doctor, he will do your BMI just via the phone. It doesn't require a test. Just go and take your height in centimeters, take your weight in kilograms. Call a doctor, ask him, doctor, what is my BMI? It's the only indicator which shows us that we need to reduce weight, we need to increase weight. BMI. You must understand that. So those are the risk factors basically, and the warning signs. Oh, there's something I forgot to say about
the high risk and to detect.
So also people who have painful sexual intercourse, you are candidates for infertility. When you have that, we call it dyspareunia. Those are medical terms. They may not use them. Dyspareunia. If you have painful sexual intercourse, you have to suspect there could be a big problem. Basically, that pain might be coming from the mouth of the uterus, that is the cervix. And it is another cardinal symptom for cervical cancer, cancer of the cervix, or cancer of the mouth of the uterus. So, that dyspareunia, it is another sign that, oh, doctor, a doctor will suspect and say, oh, you have a high risk of infertility if you have painful sexual intercourse. So it's another sign you can detect other than heavy menses, irregularities of periods, and etc. And you must understand, control your weight, not to the thinnest weight, not to the maximum. Just have a normal range. Yeah. So those are the risks and the predisposing factors to infertility.
In Uganda, we have a slogan which says, "Ebiwoma bigwa byocha." The sweetest things, they always finish as soon as when even they are still hot. I wouldn't like to say goodbye to you, but allow me to tell you that it's the end of the show. It's not the end of Dr. Coming. There are thousands of questions I have on my list, which I would like to ask as well. But time and time. This message has been brought to you by Fundamental Human Rights and Protection. Your liberty and freedom matters, and it belongs to every human. One of your freedom is to be healthy. That's why they bring this program a health clinic. Doctors elaborated and given this message for free. Kindly, don't be selfish. Share it. It's me, your host, Jita Says, on Youth Media, the new era. I remind you, we are there with you everywhere. On your phone, on your tab, on your laptop, on your smart TV. What I can say is that Doctor will come again and add more.